we know somebody that has one. How many know somebody that has one? Surely you do. There's where I see hands. Okay. So we tend to think the person does, it's the luck of the draw, and you got the bad genes causing autoimmunity, and that's maybe what the doctor communicates to you. And the feeling is your immune system's really stupid and you can't do anything about it. Like, why is my immune system that's supposed to protect me attacking my body? So that's what we get into thinking about, is that I'm doomed. Like, this is over. And you just screwed, and that's just the way your genes are. But flip. But the absolute best that we can come from that is symptom control while the underlying problem keeps going on. So we can, and people need when you're really, really acute, you need the medicines, you need the Western medicine, you need the drugs, etc. But they don't really fix the underlying issues, and they don't really calm the immune system, and they don't really get rid of what's triggering the immune system to go off. So the best that can happen from just doing the medications and things without doing underlying issues is that you get some symptom control while your health keeps spiraling down. Go to the next slide. But the other way to look at it is that person's genes are just unique. They're more reactive to things in their environment. I have the genes for celiac disease, so I'm more reactive to stuff in my environment. I'm naturally more reactive to gluten than somebody that doesn't have those genes. But the thing is, we can do something about how those genes express. It's called epigenetics. How many know that term? One or two of you do, right? So that's really where the whole world is coming right now, is epigenetics. That's how our lifestyle, our stressors, our diet, our exercise, etc., influence whether our genes turn on or stay turned off. And so we can do something about this. We actually have some power in our hands if we're in an autoimmune state to actually do something to get healthier. We're not doomed. And flip forward. So the best that can come from this belief, the best that can come is true health. So I'll show the slide later on, but I didn't get into this doing this kind of stuff like on purpose. Another chiropractor contacted me. He was in the hospital over here, the next hospital down Lourdes, and he just wanted a little bit of help, a little bit of advice. He'd already been in the hospital for 30 days, and when I walked in there and to visit him, he was like, could move his fingers this much, and he could move his eyelids a little bit, and that was it. Totally paralyzed, polymyositis is an autoimmune attack on his muscles. He lost 50 pounds of muscles. He could just barely move anything. And so we started giving him some advice and things. I'm not going to say what I did or didn't do there, but and then as soon as he got out of the hospital, we worked with him like 3 or 4 nights a week, and then he would finally got where he could come in a wheelchair, and he'd get in his PATS bus and wheel to our office, and we'd do a bunch of stuff with him. 9 months later, although Vanderbilt University told him he'd never walk again, he was able to go back to California and start practicing again. 2 years ago, he ran a 5K. Vanderbilt University told him he'd never walk again because he applied principles that I'm going to talk about tonight. So I learned some in working with him. He taught me some, etc. Then, a few years later, I have a front desk person that she's been working with me for about a month. She starts saying, "Doctor, where's my eyes are? Something's wrong with my eyes. I'm concerned about my eyes." I said, "Well, you better go get them checked. Take time off and go get them checked." She went and got them checked. He calls in another specialist. They call in another specialist like right then. Within 3 days, she was legally blind. From normal vision to legally blind in 3 days with an autoimmune attack on the retinas of her eyes. It's called AMPI, acute multifocal pigmoid epitheliopathy. So big words. But big words can be scary as heck, but the principles aren't scary. And so when you apply principles, people can get better. So as soon as she got off the steroids, and she had to have the steroids, so this is not a knock medicine talk by any means, she had to have the steroids. But as soon as she got a little break from them, we did some immune testing on her. That showed us stuff was going on with her gut. And then we tested her for food sensitivities, and she is super reactive to gluten. Then we tested like her vitamin D, and her vitamin D was low. And then we tested her gut, and she had a parasite in her gut, and she had some yeast overgrowth in her gut, and so forth. And one by one, we started peeling away those pieces, and she actually regained her vision. She just wears glasses like I do for some distance correction, and that's it. She regained her vision, and they didn't have any idea if she'd ever recover her vision. So that's how I got into doing this. Like people that are right there, like, can you do something to help me? All right, so to win with autoimmunity, we have to think globally. We can't just think at the tissue level. If we have autoimmunity eye, we just can't think about the eye. We have to look at the whole big picture. And so we missed the first slide, but now I see a lot of patients with autoimmune stuff, and I've had people, I've consulted people in Europe, and we've had some patients fly in from California and Oregon and places like that to see us. So go to the next system. So this is kind of a big picture here, but I just want to give you a concept about everything is working together. And so we know about the mind-body connection, right? But there's a real center in our brain that's the epicenter of that. It's called the hypothalamus. And it has two-way communication with our emotions, emotional processing centers, two-way communication with the rest of our nervous system, our autonomic nervous system, our spine, etc. Two-way communication with our biochemistry and our hormones, and two-way communication with our immune system through immune messengers called cytokines. Big word, but immune messengers. So all that works together. You can't separate it out. So what I do is help people figure out the pieces so that they can get healthier again. And what the medical model does is give them the medications and things when they're in acute situations, so they can control some of their pain and control some of their joint mobility and things like that. So again, people often need those in the beginning, but if they apply the right principles, they often don't need those. We have lots of people that get off of all kinds of stuff, methotrexate and all these kinds of things. Humira and all that stuff. Not because I tell them to get off it, because they get healthy enough that their doctor can take them off of it. And so go to the next slide. So there's 5 things we work through in helping somebody, helping them deflame their diet, get the grains out of their diet. I'm taking care of a physician currently. As soon as we got the grains out of the physician's diet, they improved dramatically. We help them stabilize the immune system. So when the immune system goes unstable, it goes into a teeter-totter state. So there's killer cells and there's antibody cells, and it either flips one way or the other. So we help that stabilize. Arrest the bad guys. That means take care of the bad guys that are triggering the immune system to overreact. Then reset the brain-immune connection, and this is huge. And then live an autoimmune lifestyle. And by that I mean be sensible. If you got the genes for gluten like I do, stay off of gluten, etc. All right, so the next one. So in quenching the fire, we have to focus on our diet. We have to get some of the grains out usually that quickly turn into sugars. We got to get some of the sugars out. We got to get this membrane working right with the right kinds of fats, because it's a fatty membrane. And the receptors for neurotransmitters and hormones sit on that membrane. So critical is diet. And so we help people, go to the next slide, I'm not sure. Yeah, so we help people fight inflammation, get some of the grain sugars, bad fats, etc. out of their diet, focus more on grass-fed meats and omega-3 eggs and things like that. All right, next. And this is just too complex a slide, but the bottom line is, if our innate immune system, meaning the first line of defense, like when my skin gets pierced, what's going to react first, if that part of the immune system is weak, then it's not going to be able to take care of the infections and toxins and other things strongly enough, and then the acquired immune system that makes antibodies that tags, say, this is you're a bad guy, you're okay, you're a bad guy, you're a bad guy, you're okay. The part of the immune system that does that is going to go way overactive and overreact to stuff. And that's all we need to know there. So next slide. So again, weak innate immunity allows stealth or latent pathogens, infections to go unchallenged, and then the antibody system becomes overactive. Go ahead, next. And okay, that's more complexities. But basically, what's that saying is almost every condition, every chronic condition can have an autoimmune aspect once there's enough degeneration to the tissue. Because once there's enough degeneration to the tissue, that tissue will start breaking down. The immune system will see that and create antibodies against it. And then molecular mimicry is just confusing, where the immune system, because of different stressors, may get a bacteria confused with myelin, say myelin that gets attacked, the coating for the nerves that gets attacked in MS. The immune system may get confused between the bacteria and myelin, and as it's trying to attack the bacteria, it attacks myelin. That's what molecular mimicry is. So when bad guys get through the barriers, just go ahead and click them all. There's a bunch of little pictures that are just keep looking at it.
Okay.
I'm not going to go too complex on this, but when bad guys get into the system, we've got some initial reaction. The initial reaction is almost like a mall cop. It's big cells called macrophages, but they sound the alarm for other cells. And then we have cells that are work like a dispatch station, and they tell what cells to go to the area, and then keep clicking. And then you have natural killer cells, and you have antibody cells that attack bad guys, and you have cells that try to keep all that in balance. And so there's a lot of things that play out in the immune system when things start going haywire, but a lot of it starts when bad guys get through the barriers, like that guy getting through the window there. So what are our barriers? Our gut primarily. That's where most of our outside world interacts with our inside world, is in our gut. And so when our barriers are down, like the first thing to having celiac disease, besides having the genetic predisposition, is to have a leaky gut, so that gluten gets in through the barriers quicker than it should be, and then you already have the predisposition to react to it, and then boom, you're going to end up in celiac. So a lot of organ-specific autoimmune illnesses have too much to these natural killer cells. Go ahead and flip it. And a lot of more systemic ones have too much of the antibody cells. And there's certain nutrients that are important. You don't need to memorize those enough, you need to learn them. But there's certain nutrients that if the teeter-totter is one way, you better be taking certain nutrients and you better not be taking other nutrients. So we've had people, I can think of a lady a few years ago, she was in the hospital and just barely like able to walk, but she got a little bit better and they let her out, and then they scheduled her for 3 weeks with the neurologist, and they were trying to figure out if she had when you get the flu, you get Guillain-Barré, that's right.
Yeah.
They were trying to think if, thank you, they were trying to figure out if she had Guillain-Barré. So when she came to us right away when she came out of the hospital, and we looked at what she was taking and looked at the way her immune system seemed to be tipped, and she was taking all the wrong stuff, like she was driving herself into this by taking all the wrong stuff. And I said, you've got to get off this stuff and you've got to take this stuff. And well, when 3 weeks later she went to a neurologist, he said, well, it couldn't be Guillain-Barré because people don't recover like that. Well, they wouldn't have recovered. They wouldn't have recovered if she'd have been keep taking the wrong stuff. So when our immune system's tipped, it's very critical what we take or what we don't take. And that's all we need to know there. So, all right, so again, the primary area to look for bad guys is in our gut. Keep tapping. And so we have these barriers in our gut, and things are getting, yeah, you can go next one, that's fine. There's a one-cell lining to our gut. So when people talk about leaky gut, they're referring to this one-cell lining breaking down. And that can break down from stress, and it can break down from medications, non-steroidal anti-inflammatory drugs, and it can break down from number of reasons. All right, so go ahead. And this is what I just talked to you about a minute ago, so go ahead. And this is a doc associated with Johns Hopkins, talks about untreated gut permeability can perpetuate the autoimmune response. So go ahead. And this is an important slide, especially if you know people with more neurological, more neurological related issues or autoimmunity, is that when the gut opens up, when the barriers in the gut, these one cell lining that I showed you a minute ago, when that opens up, it opens up by a protein called zonulin. That protein called zonulin is also active at the blood-brain barrier, and the blood-brain barrier is a lining to the blood vessels that keep certain toxins and infections out of the brain. Well, when the leaky gut opens up, the blood-brain barrier opens up, and then you can get infections in the brain, and then it really drives the brain off. And so if you start looking at this stuff more and more and more, they're talking about infections may play a role in Alzheimer's, for example, and of course in MS and lots of things. So just know when you got a leaky gut, you also got a leaky brain. So that's why you have to have a healthy gut. And so the way that we test all this is a DNA-based stool analysis to figure out what those bad guys are and what the integrity of the gut is. And this is like really cool stuff. We do put some codes on there in case insurance pays part of it. Some diagnostic codes on there. But it's DNA based, so it's not based on something growing out in culture. And so we find a lot of stuff that gets missed otherwise. 2 years ago, we did this test on a guy that had been through every workup in Paducah, went to Mayo Clinic, and I don't know why Mayo Clinic didn't repeat some of the tests, but when we did this test on him, he had C. diff. The guy still had, after 2 years, he still had multiple bowel movements every day, like 6 or 8 a day, and diarrhea all the time, and the best Mayo Clinic told him was to take Imodium. Now, that's no way to live your life. When we did this, he actually had C. diff, and it was too severe for me to get with herbs and stuff. We had to refer him to a GI doc in town, and a different one that he'd been to before. They put him on an antibiotic, cleared up. He's a happy guy. But anyway, that's. I just want you to know that we don't just like guess about some of this stuff. This is really state-of-the-art testing. All right, so next. And these are some of the different infections that have been associated with different autoimmune illnesses. I want to just key on this one. Like I have about 6 patients right now with Hashimoto's and I'm talking about active care, that I know that Epstein-Barr is their triggering agent. It's what's driving them into Hashimoto's. We just had in our autoimmune group, and I'll ask you if you want to get in that in a minute, but in our autoimmune group, we just had a girl that she was Hashimoto's, really severe. We'd started working with her a little bit, but the physician had her on too high of medication, and she flipped, which means she flipped into hyperthyroid. And when she flipped, she went into a thyroid storm and had to go in the hospital, and etc. And really, really bad for a while. But when she got out, we did some more of the work that I'll talk to you about later. And then we got her on what's called series therapy, which is a homeopathic therapy that changes the dilutions of the homeopathic 10 times in a month and then 10 times in the next month. And that totally apparently resolved her Epstein-Barr, because now she has normal thyroid labs and she doesn't take any medication for hyperthyroid and doesn't take any medication for hypothyroid either. So pretty cool. Go to next. I don't expect you to read all that. Just know that this is somebody that, it took a couple years really, but she was on Plaquenil and methotrexate and all that stuff when we started, and we figured out that she had a parasite in her gut, she had H. pylori in her gut. That was one of the first things we worked on, and then later on we figured out that she actually had Lyme, and then later on we started doing some work with lead, heavy metal lead, and so forth. Well, anyway, the bottom line is now, after working with her on all these different antigens, she's off Plaquenil, she's only on Synthroid, she gave up the methotrexate long ago, she has no joint pain and no medications for joint pain. So restoring function works if we can do it right and the patient's committed to go with it. So this is my front SCA. This is some of her labs that we did on her. This is the one that went blind within 3 days. You can see her vitamin D is 20. That's just, you're begging for an autoimmune condition if you got low vitamin D, especially if you got the autoimmune genes. So, like if you aren't keeping up on that, you need to, for sure. And her cortisol was, well, in this case, it's a little low. Couple parasites, etc. So, go ahead. Bad guys can be toxins. This is just a quote from a book about toxins are fueling a lot of autoimmune issues these days. So, go ahead, next one. More stuff from the environmental working group about even how many chemicals are in us to start with. That they tested babies' umbilical cord blood and found 287 chemicals identified in their blood. And that was environmental working group working with blood samples through the Red Cross. Go ahead. Toxins and autoimmunity. So each of us has a different genetic capacity to deal with toxins. The immune system can make antibodies against those toxins, and the toxins can alter the proteins in our body, and then our immune system attacks those altered proteins. All right, so go there. That's specifically about mercury and lupus and just kind of evidence thing. All right, so go there. This is the Gadak I told you about. When he was in Lourdes Hospital, they kept saying, we think you've been poisoned, we don't really know why. When he got out, we did what's called, I don't do these a lot anymore because I think they're stressful on the system, but we did what's called a urine challenge test, meaning instead of just measuring the levels for lead and mercury unchallenged in his urine like they were doing in the hospital, we gave him something called DMSA that binds mercury and then measured what comes out. So you can see he was sky high on mercury and high on nickel and lead. And you know what we figured out later? You know what spun him into all of that? Was he helped a friend, because he'd been doing really good, he'd been exercising a lot, strong. He helped a friend refinish their hardwood floors, and then they slept in the house. And not only slept in the house, they slept in the house with all the chemicals that they used on the floor underneath the bed. And within 2 weeks after that, he was laying in the hospital with all kinds of muscle loss. All right, so now I'm going to get into some really neat stuff. So there's a whole big study on childhood stress and autoimmune disease in adults. So how many have heard of the ACE study? Y'all? Are you serious? Okay. Huh? Okay. Yeah. So you need to start looking at this, whether you're interested in what I'm talking about tonight or not. You need to start looking at all the studies around ACE, adverse childhood events. So the ACE study these studies have been going on for 10 to 20 years. It started with Kaiser Permanente Health Group out in San Diego, California. And one of the docs there was noticing some interesting trends. And he convinced the CDC researcher to look at them also, and then they decided to do some studies on it, and then now it's parallel to there's at least 50 studies involving ACE events. So ACE events are childhood events like divorce of parents, a parent that may be abusing alcohol, death in the family, a parent gets jailed, those kinds of things. Those are ACE events, adverse childhood events. So there was 64% reported at least one ACE event, and compared with persons with no ACE events, persons with 2 or more ACE events were 70% increased risk for hospitalizations with a Th1, that would be organ-specific autoimmune disease as an adult, and 80% for the Th2, the other side, and 100% risk for rheumatic diseases. So if they had several ACE events, they were 100% more likely to have like rheumatoid arthritis or something similar as an adult. 100% more likely. And, yeah, that's okay, stay there.
I'm so tempted.
Yeah. So for protection, we have an area of our brain called the limbic system, and it responds the same as it does for physical stress, like hitting our nail on a hammer and we jerk away. It responds the same for mental emotional stress. And particularly with the childhood events, they get wired into our limbic system. And it does that for our protection mechanisms so that if similar things come along, we can react appropriately in the future, but then it becomes a big drag on our system because lots of things cause our system to overreact subconsciously and we don't even realize it. So I'll go back one more time. So this is a really big thing. So there's lots of associations between adverse childhood events and different conditions. So how many know a kid with ADHD? I don't have the slides up here, but a kid, it's almost twice as likely to have ADHD if a kid has had adverse childhood events than a kid who hasn't had adverse childhood events. And that's just one of many, many examples. Lung disease, heart disease. There's more heart disease in people that have had these ACE events in their childhood. So I encourage you to start looking at that. I think it'll open your eyes up about a lot of stuff. It really, really will. Because, we sometimes hear doctors say, a lot of disease is due to stress, but nobody does a darn thing about it, for the most part. All right, so go next. So again, we talked about the limbic system reacts the same for physical pain as it does for mental and emotional pain. The brain can't tell the difference between physical pain and emotional pain. All right, so go to the next. So this is just more about how that happens. Our brain perceives threats. Am I safe? Certain brain centers say, am I safe? The next brain centers say, am I in danger? If they get an answer to both, there's a nerve pathway, a literally pathway built into what's called the hippocampus, the memory center of the brain. And it becomes a programmed automatic response that's built in so the brain can react to similar stresses in the future. Go ahead and click the next slide. All right, go back one. I don't think I have this slide in here, but this is so interesting. This is one of the most interesting things I've seen in the last year. And to show you how the immune system and the brain are connected and our emotional stresses are connected is that teenagers who have experienced sexual trauma will have elevated eosinophils in their blood. Eosinophils are a type of white blood cell that we typically think of as show up when there's a lot of allergy responses going on or when there's parasites going on. But they found out that teenagers who have sexual trauma will have elevated eosinophils in their blood. Their blood will show it. But interesting, when you think about that, sexual trauma, you think about the relationship between a parasite, somebody that's a bad dude, creating that, or an allergy response, the immune system still wants to get rid of something or wants to overreact to something. So it's really fascinating how our brain and our immune system are wired together. For example, the left side of our brain helps initiate the immune response. The right side of our brain helps turn it off. So most of the patients I see with autoimmune illnesses, their right side of the brain isn't firing as strongly as their left. I can see it in their posture. This is what happens if your brain doesn't fire as strong on the right side as the left. This side will be back, this side will be rolled in. I'm exaggerating a little, but that's what we'll see. And then we'll lay them on the table. They'll be strong on this side, and they'll be weaker on this side. I'll just be able to push through the muscle, won't be able to lock. And that's the right brain firing out as strongly. We'll see that, by the way, in kids with ADHD. Not so much that it's tied to the immune system, but we'll see right brain deficient. And there's ways that we fire up that side of the brain. Now go ahead and next. So a lot of these emotions will store in different areas. The thyroid will store the feeling of powerless. The colon might store indigestible anger. The breast might store worry, arguments, feeling unsafe, etc. So go ahead. And when our nervous system becomes unbalanced, it'll either go in an over-aroused state, like high blood pressure and irritable bowel and anxiety, or it'll go into a under-aroused state, worried, depressed, constipated, things just there's not enough activity, low back pain. Or it can go unstable. That's where all of our patients with autoimmune stuff are in the unstable phase while they're active with it. Every one of them. And that's where you see food allergies and things. And then when the nervous system gets really dysfunctional, it'll be highly over-aroused, just super high blood pressure, sleeplessness, or just totally exhausted. That's where our patients with Epstein-Barr often come in. Fibromyalgia patients. All right, so go ahead. And this is the same thing we talked about before, but again, everything is connected. So if I'm driving neurological input in here, I'm influencing the hypothalamus, which can influence the hormones, for example. Like if a person has a lot of pain, they're going to make more cortisol because there's going to be too much input here. That's going to drive this to be hyper, and then it's going to drive the adrenals to overproduce cortisol. So we have to understand the relationships of how all this works together. That's like the key to it. And when we're driving all this ACE events that are locked into our limbic system of our brain and they're firing when we don't even realize it's firing, that's feeding into our hypothalamus also, and that's creating immune messengers that are throwing our immune system off. All right, so go to the next one. So these events, these ACE events, and adult events too, don't get me wrong. These become entangled in the brain, and it builds strong pathways for reacting in an inflammatory nature to foods, infections, to environmental toxins, and then we can actually spin into what we call core drivers or core beliefs and negative patterns. Negative patterns are self-sabotage patterns. Core drivers are things like it could be feeling unlovable, feeling unsafe, feeling powerless, etc. And so it's like glasses on our system, and we don't even realize that we have a tendency to feel powerless when certain things happen. Go back. And so these wounds wire together in the brain. So a lot of times, even when we're working with people with a lot of chronic pain, we'll be working on their emotional traumas and resetting their brain. I'll talk about that in a second. But it's really amazing what the body tells us. And even in working with patients with autoimmune issues right now, one of the best tools I have is to read what their body is telling me. Now I look at labs and stuff too. We get labs on every patient. But if I do some functional tests in the brain, like if I bring this in and I see a muscle react, I know the cerebellum may be involved. If I go up here, they follow their eyes up here and they react, and then especially if they also react when I put some sound here, that's the temporal lobe of the brain. If I'm down here, that's the parietal lobe of the brain. If they react with the eyes going up and then slow movement to the side, that's the motor lobe of the brain. So I can tell what areas of their brain aren't firing like they should. And then I can just take some laser light that I keep in my pocket here, and I can shine a laser on different tissues associated with that area of the brain. And when I get a change in their nervous system, that's where that's the tissue that's storing the emotions. Like I showed you a minute ago, say it was the thyroid, that might mean that it's storing powerless, etc. So I can check a few more points like that, and I can zero in on exactly age, and I'm not doing it from being psychic, I'm doing it from mapping of what the body is telling the person, and the doctor that developed it listened to thousands of patient stories and see what showed up as far as brain areas and tissue areas. I can tell the person exactly, this looks like a stress at 20 years old, it looks like feeling unsafe, unsure, unbalanced, and victimized. What do you know about that? They'll say, well, that's when I had blank. And then we'll say a statement like, I'm letting go of blank because I'm no longer feeling blank. That means we've got the right thing dialed up on the screen of the brain, and then we literally reset the brain with light, sound, touch, cranial nerve activation. So they might be looking at this light coming in and out, and they might be pushing their tongue over and elevating their shoulder because we're activating cranial nerves. So we give a lot of neurological input to literally let the brain reboot itself. and it's called quantum neural reset therapy, and that's the stuff I've seen people from 11 states for in the last year and a half. We just saw a girl from Oregon a couple weeks ago. All right, so quick there. All right, so what I want to talk about is one of the things we check people on is heart rate variability, because our autonomic nervous system is really important, and that's a part of our nervous system that functions without us thinking about it. So if we're in fight or flight, the sympathetics are engaging. That's when we get all these stress reactions. It's when our heart speeds up, and that's when all the blood goes out of our gut, so our gut doesn't work right anymore, and we're ready to fight something, and we're ready to run away from something. And then on the opposite side, we have the parasympathetics, and that's a vagus nerve that comes down from the base of the brain and innervates all of our gut and slows our heart. So we see what's going on with people, and my heart rate variability system has a comparative database in it of thousands and thousands of other readings, and so we can compare the patient's readings to this huge database. And so a lot of patients, some patients will be more of an anti-aging pattern, like they might be 55 and their readings look like a 45-year-old's, but some people are 55 and their readings look like a 75-year-old's. And so we got to change that. And this QNRT, releasing this emotional trauma out of the brain, it's one of my number one things to change that. And we've got patient after patient where we can measure on an objective test that we've improved their nervous system. And so we're seeing people from all over the place for that. All right, so go ahead to the next one. And this is just a little more about left and right brain differences, but as I mentioned, the left side of the brain will activate the immune system, the right side will help shut it off. And other talks, kids' brain health or talks like that will go into those other things. All right, so next slide. And again, when we're resetting the brain, we're just using the senses. So we're using light, sound, touch, patient touching themselves on words, and we might have them doing balance things, other things. We're using these senses to reboot the brain. All right, so go ahead next. That's me doing neurofeedback. Neurofeedback is a computer-based training for the brain, and there's a couple sensors go on the scalp and on the ears. Nothing goes into the brain, but the computer's reading the electrical activity of the brain, and when that electrical activity, it's looking for multiple different parameters of the changes in the brain waves, and it sees a significant enough change, it stops the music for a split second, which alerts the brain that it went off track, and then the brain can decide what it wants to do with that information. So I say it's like driving down Interstate 24. You get off on the bumper strips on the right, they're rattling and making noise, or I have to tell you that you moved out of your lane. And if you want to stay in your lane, just steer back in your lane. If you want to pull off the side of the road, you pull off the side of the road. But either way, the bumper strips told you that you moved out of your lane. That's what the computer does for the brain. So this is just a study. Neurofeedback significantly reduced symptoms of depression and fatigue in multiple sclerosis patients compared to treatment as usual. And these effects were maintained at a 2-month follow-up. That's in a journal anyway, applied physiological biofeedback. All right, so next. And so this is kind of where I started with epigenetics, meaning our lifestyle, our changes, our diet, our exercise, our nutrients can make a huge difference. And go to the next. And these mice have the same genes, they had a different diet, they had different epigenetics. So again, don't tell me things can't change around. So go to the next slide. And that's deeper than we want to go. But we do occasionally go through a person's genetics. We can have them do something called 23andMe, you've probably heard of that, or Ancestry, things like that, and get a raw genetic file, and then we can look at where the weaknesses are. Like Debbie and I both have this MTHFR. It's a weakness in getting folic acid into its active form that the cell can use, that the immune system can use, and the brain can use. I don't take anything for it most of the time because I have a really healthy lifestyle. But if I get down and depressed, I know I got to take some active form of folate, or active form of folic acid, a metabolically active form called 5-methyl-tetrahydrofolate. That's your big word for the day. So I got to take that to feel good. But anyway, so we can look at patient genetics. I don't know if always go that far with people, but all right, go ahead. So that's more of that genetic stuff. So an autoimmune lifestyle to me is a low inflammation diet, no toxin exposure. I mean, I'm the freak that doesn't put chemicals on his yard. My neighbors have chemicals on their yard, and their yard looks better than my yard, but I don't give a crap because I'll probably outlive them. So that's the way I look at it. A person living an autoimmune lifestyle knows that their brain, knows that their emotions contribute to their immune health, and then listens to what the body is telling them, and loves themselves where they were at. The number one thing I had to help the guy with, because the guy I was talking with you that I met in Lewis Hospital and couldn't move, and then he recovered. He was determined. I mean, he was really determined, but he kept pushing himself too far. He'd beat himself up by he wasn't better, and he'd push himself too far, and then he'd backset himself all the time. And I had to keep reminding him and working with him in the neuroemotional techniques that we had at the time, that you have to love yourself where you're at. When you love yourself where you're at, it gives you the opportunity to move to the next level. Loving yourself where you're at doesn't mean that you don't want to get to the next level. It means you don't beat yourself up for not being at the next level. And you can apply that in a lot of areas of your life. So not beat yourself up where you're at, love yourself where you're at, and then you have the opportunity to get to the next level. All right, so this is another patient. This is a patient we worked with for a while with, again, Hashimoto's thyroid. And we worked on a number of infections and we did some emotional release stuff out of the brain, and we worked on inflammation levels, and now she's a healthy weight. She doesn't take thyroid medication. All right, so this is the guy that I was telling you about. So Dr. Tom, and go ahead next, and that was his picture when he left Paducah, and then that was his picture a couple years later. And as I mentioned, 2 years ago, and he's actually in my autoimmune group, like a real live person. He's and so is my former staff member who lives in Florida now. All right, so go back just a second. So people really can get healthier. I don't know that I'm going to get every single patient healthier, but we get a lot of them way healthier. And we get a lot of them healthy enough that they can get off their medications. And again, we're not telling them to, we're just helping them get healthy enough that the doc can start pulling them back. So how many know somebody like that would like to be healthier? So I'm going to ask you to do one thing if you're interested in it, is get in my autoimmune group, okay? So you got your phones there? Everybody, how many are on Facebook? You're probably mostly on Facebook, right? All right, get on Facebook, go to the search engine, type drugless, D-R-U-G-L-E-S-S. Drugless support for autoimmunity. And maybe you don't have an autoimmune condition, but I bet you could add somebody in there that does. And really the things I've talked about tonight apply to a lot of chronic health conditions. And a lot of chronic health conditions have an autoimmune component that people just don't realize that that's the case. And while you're doing that, I'll just talk a moment. Like this work I was telling you about, reading what the body is telling me, that we have some reflex points with that are stunningly amazing when we get a reaction on a virus point and it's right there, or another one's right here for Epstein-Barr. Like almost always the patients already knows they've had it, knows it's active, or they have a big family history or a personal history of it, or different things. And so these points are just amazingly accurate in comparison with the person's history, but it allows us to know what we're working on and how to really target things. And the body's pretty amazing what it tells us. So we have exact systems to deal with this stuff, and that's why people are coming from quite a few directions to see us in 11 states in the last year. So did y'all find it? Drugless support for autoimmunity? All right, so just click in there, join, and I'll prove it here in a minute. And all right, so I'll finish up and always believe in people need to take action, and if you're interested in a chronic health condition, I'll tell you how to get some help from us. But I want to, because we're here, what time is it? We're doing
6:55.
Oh, see all that? No, it's just been an hour. Y'all have to stay for an hour, or you're done when I'm done? Huh?
They still have to stay after you're finished.
Okay.
They have some business
I
to
wondered
take
about
care
that.
of.
Okay. All right. But do y'all have particular questions? Because I don't usually, when I do talks, I don't usually do questions, but on something like this, I will. And so, what's burning in the back of your brain?
The GI lab test, how much is that?
How much is it? $359. Sometimes insurance will pay half of it, so a patient co-pays, if they have conventional health insurance, co-pays half of that, which is $179, I believe, and then the lab bills insurance, and if it pays it, great, and if it doesn't, they send them a bill for that.
Is it something that you recommend the testing if you don't have any quote unquote symptoms per se?
Yeah, you know,
or like
it's
you
really
don't feel
interesting.
any different
We
from-
tested a guy a couple weeks ago that he didn't have any major symptoms, but when we got his test back, he had I think 1 or 2 microscopic parasites, and he had really high inflammation levels in his gut, which would predispose him, if he doesn't do anything about that, predispose him to be more susceptible years down the road to colon cancer and things like that. So sometimes you find stuff you don't expect, especially on the gut. Like the gut is really where you find stuff that you don't expect. Yeah. We do a lot of testing with, and I know you're all. So we do a lot of blood labs, and so some patients we will send to LabCorp and put a diagnosis code on it and so forth, because we know that they have conventional insurance that may help them out some with that. Some things, if we're doing lab work that's just probably the insurance is just going to find it not medically necessary, then we will use a lab co-op. And a lab co-op still goes through LabCorp, but it's a co-op that has buying power of hundreds of docs, similar to myself, around the country that we get like there's a particular thyroid panel that I do that has about 9 thyroid tests versus the 2 or 3 that you usually get conventionally. 3 at the most, probably 2. And then we look at a number of the full iron panel and the full lots of different inflammation markers, etc. in this panel. So we get that test for $212, and that's all that we charge a patient. My attorney told me years ago not to mark up lab tests. And so the patient gets that for $212, but a couple times LabCorp hit the wrong button in the computer, and so they billed me for the lab instead of the co-op, and it was $1,400. So that's the savings of the lab co-op. So we use that quite a bit too. And then some people, if they've got pretty good insurance, and we use another out-of-network lab, but it's not that. It really turns out to the patient's advantage because the out-of-network lab has some decreased costs, and they can afford to write some stuff off if the insurance doesn't pay for it. So again, we can get sometimes several $1,000s worth of tests, and the patient might only end up with paying $150 or something. So that's a lab called Vibrant America. That one we actually draw at our office. The rest we send out. And we do hormones. I like to see blood work, but I also like something called a Dutch test. And I don't know if you've ever heard of that, but Dutch test stands for dried urine testing for comprehensive hormones. And what the advantage of a Dutch test is, and y'all really ought to know this, is that a Dutch test in this dried urine, they can look at not only your estradiol, but your 3 estrogens, and then how all those estrogens break down. So you can see the estrogen metabolism pathways, and you actually have an opportunity to fix it before you get in trouble and go over to wherever it is over there and get radiation and chemo and etc. for breast cancer. So you actually have an opportunity to fix stuff ahead of time. And I'm not sure why the conventional model hasn't done more with that, but you can actually see if it breaks down into what's called 6-hydroxyestrogen, 2-hydroxy, or 4-hydroxyestrogen, and some are more problematic for breast cancer than others. And then you get to see about the second phase of estrogen breakdown. So you get a lot of information where you can be proactive about your health. And that tests, if you just do the sex hormones, it's $150. If you do the sex hormones and the adrenals, which we do in a lot of people, it's $250. And you got to pay the lab. It's out-of-network lab. You got to pay them up front, but we can put some codes on there, and depending on your plan, you might get some reimbursement. So that's what we do on hormones. And then we do have some nutrient deficiency testing, like this Vibrant America has a test where we can look at about virtually every vitamin and mineral in the body, both in the serum of the blood and at the cellular level. So it's pretty cool. That's like maybe, I can't remember, around 200. If you have insurance, maybe 300 if you don't. But it's really comprehensive because, like, if you go to LabCorp, you got to check 100 different boxes. It's all disjointed and it's not the same. So we do that for nutrient testing. For other types of autoimmune testing, this Vibrant America has some amazing food sensitivity tests. They have something called a gluten zoomer, which tests about 45 different ways that you can be reactant to gluten or components of wheat. And so it tests not only the gluten, but the gliadin and multiple markers with that, and wheat germ and proteodyne, all the stuff I can't even pronounce. The things that even show if you're getting a morphine-like reaction to gluten. And those people that are, they're the ones that have a hard time getting off gluten because the brain's getting stimulated by it. So anyway, that's called the wheat zoomer. They also have comprehensive testing for food sensitivities, 99 different foods on delayed reactions. They have testing for something called lectins, which are proteins in certain foods that can give some people with autoimmune illnesses a problem. They have some advanced testing to see in the wheat. Wheat zoomer will tell if your gut's breaking down, leaky gut markers. But they also have a testing called the neural zoomer, which will actually show if you're having autoimmune tendencies to the brain. So it's like a screening to see if you could be headed toward Alzheimer's or something like that. So it's pretty cool. There's a lot of stuff out there lab-wise, and there's a lot of those that I'm the only one around here that's doing that, but that's just what I do. Any other questions?
What's the most you have a most common autoimmune disorder that you see? Is it fibromyalgia or is it
Hashimoto's, I would say, is the most common, but we see a lot of people with rheumatoid type stuff also, and certainly some people with fibromyalgia type issues, which often is autoimmune tie-in. And then just a lot of people that nobody knows what box to fit them in. I mean, they don't really know what the name of it is for them, but they know they have a chronic health problem and they don't feel very good, and nobody's really been able to help them much. And so we have a lot of those people. And the other thing that we have that may be surprising to you is we have a lot of kids that are autoimmune to strep. And these kids have a lot of behavior issues and a lot of quick tempers, and it's pretty significant. And until I started working with these reflex points to identify it, I had no idea it was so common. And then some of them already have strep antibodies that they've measured with their physician or something. But there's a lot of kids out there like that, so kids aren't immune to autoimmune problems, but strep is probably the most common ones we see with kids. And then we see a few kids with autism and stuff like that, and they're usually more autoimmune to a heavy metal, mercury, lead, something like that. That's on the kids' side. All right, any other questions?
I have one,
Yeah.
I saw on one of your slides, there was something associated with Lyme disease.
Yeah.
How much have you worked with Lyme?
Well, more and more the last couple of years, but it's so hard to pinpoint on conventional labs, and it's so, and if you use some of the labs that are a little less conventional but are more Lyme oriented, I mean, you're talking $1,500, $2,000 to just get the testing. So again, I found it with these reflex points, and then I do some other confirmatory stuff, and then I compare it to the patient's history, and we've helped some people straighten out lately with what I honestly believe are Lyme-related illnesses, but I just didn't spend all the money on the testing because they'd had it for a number of years or whatever, and it wasn't showing conventionally, or it did show conventionally in the beginning, then it looked like it was resolved, but it wasn't really resolved. So there's a lot of people with Lyme-related stuff that, you know, they take the initial round of antibiotics, and I reckon if people come in and say I got bit by a tick, I want them to go get antibiotics. So again, I'm not against that, but a lot of times the first few rounds of antibiotics don't always resolve it, and then most people end